let it go. Stretch. There it is.
Oh.
Go ahead and keep the knees bent. Yep. Whenever you just cross this arm under. All right, I'm gonna help you a little sit up for me. Take a little sit up. Just loosen up this middle back. Exhale. Here we go. Exhale. Keep exhaling. Let it go. Good. Deep breath in. 2 more. Exhale. Let it go. Here we go. Chin down a little bit. Keep going. All right. 1 more. Deep breath. Let's try to get this back moving here. You're all tight. Exhale. Chin down. Chin down. Exhale. All right. Good. Yeah, we're gonna get them all. And then hands around your belly for me. I'm gonna bring this arm up a little bit. Perfect. Come a little closer to me.
Okay.
There we go. Okay, take a deep breath in for me, and then exhale for me. Look over this shoulder as best you can. Exhale, exhale. Good. Other side for me. Ankle behind the knee. From your shoes. Look at all those look at the calluses on your feet here.
Yeah, I wore bad. My workout shoes broke, and so I wear an old pair of shoes. They were terrible.
Oh man. All right, deep breath. Exhale. Try to twist. Look over the shoulder. Yeah, here we go. All right, good. Face up for me. Okay. All right. Just feel here. Atlas is over to the left a little bit. And the second bone's off to the right. We want to make sure everybody's loose, and then we're going to try to aim you back in that curved position. Okay. We start with the right side here. Let's go. I got you. Easy, easy. Let it go.
Oh.
There you go. Beautiful. We could be like the other channels on YouTube. Oh my gosh, that was the best adjustment I've ever. What a release. Little disclaimer at the bottom. Patient was paid to do.
Yeah.
I got you. Here we go. Easy, easy. Relax this side. Let it go. Beautiful. Oh wow, nice and loose now. Gee.
Yeah.
Wow. There you go. My joke was to make like a fake commercial. My wife and I were thinking about making this thing called the, do you want to have the people's elbow with you wherever you go? Introducing the people's elbow cup holder.
Yeah.
Where I make like a actual mold of my arm and a little cup holder. Bring the people's elbow with you anywhere.
That's funny. Yeah, I need to start going to the chiropractor my husband goes to in Tampa. He found actually a pretty good one.
Cool. All right, well, just have him work on this upper neck, keep this moving. What happens is that pain you described really is from the upper neck being too jammed up, and then when you exercise, your lower neck is just being overstressed. That's all that really means to me.
Yeah.
And there's pressure points, and the pressure points have, only the parts of your spine that are moving are the ones that end up getting stressed, and the lower neck is the most commonly stressed out area, so keeping this upper neck in the game up here.
C5, C6 is where my herniation.
That's exactly right. That's because that area has been your main functioning area for too many years, and the upper neck sits on the sidelines and just watches the football game. We got to get this.
Yeah.
Keep the upper neck as loose as possible.
And I bought one of those scrapers.
Okay.
So I use that at home.
Good. That'll help to keep some of the soft tissue bruising and inflammation out of the area.
Yeah, so like when I feel it get cramped up, I just kind of use it for a little bit.
Yeah, it's amazing. The muscles, when our posture's not correct, the muscles are working harder. When there's injuries, your muscles guard areas. And muscles, like if I held a bowling ball out with my arms outstretched in front of me, my muscles work really hard, right? And so they would build up a lot of lactic acid, and that lactic acid is what you can rinse out yourself from these muscles that are just perpetually tight. Otherwise, then there's a constant soreness in the tissue. You want to rinse all that out. Less yakking, more cracking. I know. Cost double for being quiet.
Yeah, this side feels worse.
Okay, yeah. These are the roots of your neck. Push these roots down. Any more travel plans coming up, or you just gotta?
Yeah, going to Nashville at the end of the month.
Okay, cool. All right.
Just a couple days.
Okay. Yeah, I can tell you've worked on this a little bit. There's not a lot coming out. If you
Yeah.
work on it yourself, there won't be a lot of buildup, like brushing your teeth. It's already a little bit right there.
Yeah, there's just some spots I like can't reach, especially like on my back. Oh, yeah.
Mm-hmm.
Yeah, and I can feel that travel.
Mm-hmm. Yeah, I'm gonna work on that. Get all that. The other thing that's not really transmitted on the video is how I'm not putting a lot of pressure, right? It's a pretty gentle amount of pressure. It's not like I'm
No.
like digging as hard as I can. It's very gentle. It's just gliding the tool over the tissue, and if something's there, then it comes out, and if not, it doesn't.
Yeah, see, that's my problem when I'm at home. It's sometimes I'll like
Hard
dig
to reach.
in.
Yeah, you can't.
Oh yeah, I'll be like, eh.
Mhm.
Like if I'm in pain, it's like, you know, digging in kind of feels good.
Right, right.
I know I shouldn't do it.
Well, you can. I'm just saying it doesn't have to.
Yeah.
You don't have to.
Okay.
It doesn't have to. You know, you can.
People criticize it online, like
Right.
he's pushing so hard, or they say he's making them bleed, which isn't true.
Like it's just a
Oh
reaction.
no.
Yeah,
Like it's just a reaction of beating you up.
like
Oh,
you're not
no.
making her bleed, right, babe?
I know this is so much more gentle than even what, like if I do it to myself, it's way worse. Then I also have a high pain tolerance, so my scale, but genuinely it is very, very light. Oh yeah, right. Yeah, this is all what I can't reach. Yeah, it goes up to my jaw and up to my temple.
Just let the jaw relax open just a tiny bit. There you go. I love masseter work. Just going in here and releasing this is all the main clenching muscles, your masseter, and just we hold so much tension right here. It's like even at nighttime we subconsciously release, you know, our mental tension right here in our masseter and our jaw. This is how we clench everything up right here, and so just need to bring oxygen in here to prevent this muscle from so easily getting tight. If it's already filled with lactic acid, just a little bit of, you know, nerve aggravation, it just goes right into a spasm.
Yeah. Yeah, as soon as you touched it, I was like, man, that's sore.
That's what's so cool about the gua sha is really the mark will only really come out where you feel tenderness, and
Yeah.
we can, if you don't feel tenderness, no matter how much I kind of comb over the tissue, I can't make a mark, and that's contra to the people that are antagonistic to the gua sha. They're like, well, you're just busting up blood vessels. Well, then why can't I make a mark wherever I want? Right?
Yeah.
The mark only really comes out where really it doesn't just really. It only comes out where internally there's something like you'll tell me, Ed, there's soreness in there, and then the mark comes out, and right there is where the most soreness is trapped, and then it comes around. And then once that mark goes away, you'll just see a dramatic drop in the amount of soreness. And I love when people from other countries, India or Thailand or other part of the world, they go, we do this all the time. This is like a mainstream thing we do over here, but it's such a, then the Americans see it and go, that's not med, what are you doing? It's like this stuff's been done for thousands of years, yet people only consider, doctoring something that's been done in the last 80 years, drugs and surgery, which are really relatively way newer. The stuff that we're doing here has been done for many, many years, and that stood the test of time.
Maybe explain why you call it toxins.
Well, inside of our body, we're making, how about this? Let's start with the skin. On your skin is constantly cycling over, right? New skin's made, the old skin falls off. But inside your body, in the same way, we have new cells being made, and then the old cells have to be removed. Dead tissue inside your body is toxins, right? It's dead tissue. There's of no benefit. It has to be expelled like a waste. I mean, what term would you like me to use? Waste?
Yeah, so you could use a different term,
right?
But
Poop?
it's the same thing.
It's poop. It's waste. Something that's of no benefit and needs to be expelled from your body. And if you let it sit in your body, it causes inflammation, tissue damage. That's why it's a toxin. It's a poison.
I think when people hear the word toxin, they literally think of poison, like you just said.
Right.
Whereas when you say waste or something that's of no use to your body, it's it just has a different connotation to it.
Mm-hmm.
So it's like these people that are picky. It's like, what does it really matter? I hate people that harp on semantics.
Yes, yeah, I agree. It's ridiculous.
I mean, I don't know. I'm just brainstorming here, but the opposite of a toxin would be a nutrient, right? A nutrient or a vitamin or something that your body uses to benefit or to, help your body, right? That's a nutrient.
Yeah.
Right? What's the opposite of that? Waste.
Yeah.
Toxin.
Yeah.
Your body doesn't use this for a benefit, and it needs to be expelled.
But Michelle's right. The semantics.
The semantic.
It's just semantics. It's just people that are ridiculous. Like I know people who are like that, and I hate getting into arguments with them. You're like, oh my gosh, I said one word wrong, and it's like, you have to be word perfect, and it's like, but the point generally is made.
Right.
It's true.
And the bigger point is whatever you're doing makes me feel better.
Right.
Like, isn't that all that matters?
Well, that's the other thing in life. Like, how can you really even say something if you haven't done it or been through it yourself, right?
Yeah.
It's one of those things where, like you've been traveling to Europe, and I might say something about that area, but you might go, Ed, have you actually been there? And I say, well, no. Well, then how can you really say something, right?
Yeah.
Well, I read online. I was on Wikipedia and it said, right?
Yeah.
It's like, okay, well, how about you actually go there and judge for yourself? So if you're going to make a criticism of something, my first question would be, well, you've actually had it done? Because I bet you if you had, you probably would like it.
Yeah.
These ribs feel so nice. I mean, some women, like the ribs get stuck elevated. Yours are not. These are all kind of where they're supposed to be. We breathe in, the ribs elevate. We exhale, the ribs go back down, and then they just stay in the elevated position. That stiffens the chest, puts more stress on the lower back and lower neck. Makes it easier to hunch forward.
Oh.
Wow, you're tough. Strong back. You got men that, help! You. What do you got, Ed?
It's like more alleviating than anything.
There you go, right there. Yes. I heard my dad talking to a patient the other day. He's like, I just find the knots and I mash on them. If I find a knot, I just stay on it and mash it.
Feels like there's like rocks in there.
It's all those times when your body told you to stop and you said, shut up, body.
Yeah.
Little more elevated right here. So when we're on that lumbar general, we're going to do knees to the right a little bit, and we're going to try to work on compressing this spot. It should level out on its own just being on the stretch, but if you want to get a little more pressure on this right side, this will usually throw the work down to the opposite lower. So the left lower part of your back ends up taking extra stress because we're in avoidance of this right middle part.
Oh.
Oh boy, that was nice.
Yeah.
A little shoulder adjustment before I adjusted the shoulder. Okay. The other thing for people to know at home is a lot of times, I don't know what the percentage is, Carlin, but probably half of our patients at least, it's their first time ever being adjusted, right? Or ever being gua sha'd for sure, right? I mean, so it's like the first time you run the carpet cleaner. Imagine if you lived in a house for like 30 years and the first time you sweep, right? The first time you run the vacuum cleaner, you know, you're gonna get the most amount of buildup that first couple passes. And that's what you're seeing on my videos of the, you know, this is a more normal back here. Person that's had care, you know, you don't have it pouring out in large amounts. You have little spots, little areas of buildup, but you don't have it every single surface square inch of the back. You shouldn't. A lot of our patients, it's like the first time anybody's ever brought blood into these frozen areas. it really just came out where she pointed,
Oh.
right? Pretty much, I mean, a black belt patient like you will know exactly where it's going to come out, and kind of just check this area for me. I kind of feel something in there. Yeah, there's something. And then wherever I feel the knots, sometimes there'll be a mark. Sometimes you won't perceive it until I touched it. Like this spot right here, you're going, oh, there's something there, Ed. But because it was mechanically tight and stiff, we don't necessarily feel it until somebody, rubs it and asks it to bend and function and move. And there you go. But yeah, that's what I was feeling. This section right here. I was feeling. For all those people at home, they're like, the treatment looks the same. Well, I find the knots. The knots are going to be in different locations. Sometimes a person will have a patient knot up here, here. But, you're working. I just find you scan everywhere, and then you linger in the areas where there's something trapped. There you go. And there's, like I said, I can feel this when I was working on your back. This section is blocked up. You might catch yourself leaning to your left when you're sitting, see if you can check that. If you catch yourself always, kind of tilting your torso to the left.
Yeah, I sit on the left side of the couch, so I do probably lean.
Right, you just want to kind of switch up positions.
Yeah.
Make it so you have to lean the other way for a little bit, just balancing it. But otherwise, her back feels very clean. I don't have, I think a lot of people in our channel, they were just like, this is the first time somebody's going in here and clean those areas.
I mean, talking about the new guys on there who like to critique stuff, who are MDs and have absolutely no business doing that.
Yeah.
Oh.
They've never experienced it and they have no medical training in it, so it's like, shh.
Yeah.
That's good.
Again, I go back to it helps.
Good, there you go.
Like it helps.
Exactly.
It makes me feel better.
Amen.
Exactly.
Yeah. Well, it's like what you're saying is it stood the test of time, right?
Yeah.
Things that didn't work got thrown away. If it didn't help anybody, if it didn't benefit, then people stopped doing it, right? Nobody would pay somebody for it. You kind of idea. It's like these are the things that are tried and true, been done for thousands of years. Very gentle here. Relax your back. Just gonna stretch a little bit. Just stretch. Exhale. Nice. Breathe. Good. There you go. Breathe. Good. Good. Okay. You all right?
Yeah.
Arms down. Yep. There you go. Gonna breathe for me. Stretch. Breathe. Stretch. Breathe. Good. Okay. All right. Doing good. Just trying to work that spot there in. All right. Let's work. There it is.
Oh.
Nice. Right there.
Oh.
Okay. Oh, that's sweet. Go ahead and tilt to the left for me a little bit. Tilt left.
Oh.
Ooh. Go ahead and tilt left for me. Tilt left. Okay.
Oh, that felt really good.
Go ahead and tilt to the right. Uh-huh. Yeah. Go ahead and tilt to the right for me. Tilt right. Tilt your head right. Sorry, bring that right ear. Yeah. Okay. Okay. All right.
Yeah, like that, like loosened up my jaw. It felt like.
Isn't that cool?
Yeah. Oh.
It's good stuff.
Yeah.
Right on that. And then lay back. There you go. You okay?
Yeah, I'm good.
Go deeper in a second. Let it stretch into that. Breathe. Let's try knees to the left first. Shouldn't be too hard. That should be pretty easy. And now we're going to go knees right. You're not going to like it as much. Let's try going knees right. Yeah, that's the side you got to work on.
Yeah, that's right.
So I'd almost go like twice to the right for every one left, or don't go as deep to the left to your easy side until your bad side gets better. Right? Let's try to keep it level like a drawer. You don't want to push the drawer in crooked. I want to level the drawer and then we go in, kind of straight with the drawer. And when you have to fly on a plane, try to, doesn't have to be the dead roll, but a water bottle, just something. You want to put pillow, rolled up towel, something in your middle back area, right in that spot where it's pressing. It's so easy to just conform our spine to whatever chair that we're sitting in. And almost like some of these chairs I see people sit in and they stand up and they're in the exact same mold of whatever the chair held them in. And so you want to counter stretch, otherwise we get rolled up and stuck in these forwardly rotated positions. But you're doing great. How's that feel? You okay?
Yeah, it feels good.